We've got Natasha Dunn, and Natasha is a co-founder with K Winding.
That's
And
me.
they're two of several co-founders of the Black Community Collaborative, and they're also administrators of the Black Community Pandemic Prevention and Support Group on Facebook. So we're here today to talk about some of the lessons that they're learning along the way. And full disclosure, I have recently joined the group and I'm totally impressed. So you will not get
Thank you.
opinion from me, all right? This is here to share information and some of the lessons learned. But before we go there, Natasha, can you share with us, a little bit of background, for yourself and how you got to this point?
So yes, I am a very active parent, of course. I know a lot of people talk a lot about my darlings. I would say they are my motivation. And in particular to ensure that our communities are safe for them, and so I've done a lot of community work prior to them being born, but I've escalated that. I've been in a nonprofit and education field for over 15 years and have worked with community residents to help them elevate their voices and to ensure that we have equitable resources, parks, schools. I've worked with parents across the city of Chicago to fight for quality education. And I'm currently the manager of community engagement with VOCEL. And VOCEL is viewing our children as emerging leaders. It's a nonprofit organization that works in the London. We're in the actually Austin area. But our program is extended throughout the city of Chicago. We have 15 sites and partnerships with various schools, elementary schools. We provided on the site early childhood education program once a week for families who have children 0 to 4. And it's free and it's accessible and it's an amazing program. And I also am the co-founder of the Black Community Collaborative. And our goal has been to really push the envelope to create a culturally relevant voice for our community to ensure that we are not left out of resources, that our voices are at the table from a cultural perspective, and of course to also collaborate with other Black-facing groups in the city of Chicago so that we can elevate our voices.
Okay, awesome. And Natasha and I met each other, oh my goodness.
Years ago, yes.
2012.
Yes, 2012. And I was going to say the last time I actually saw you on a show together. I forgot what show was that. It was with Philip Jackson, I think.
Yes.
Yeah, we did a show together with him. So yeah, it's been a while. And I've been really fighting for education just since then. Really 2011 and 10 was when I started my own independent journey to, to just really help parents understand their power. Because I had a situation with Chicago Public Schools early on when my babies were like in 3rd grade. But, I wanted to share that and also teach parents how to understand policies and how to use that as leverage for them to be able to advocate for their children within the system. Because sometimes we have to hold a mirror to the system and say, okay, well, this says this, then why aren't you doing this for our family? So, that's what I'm also good at, is holding the mirror to our policymakers, to our political figures to say, this is what you're doing, but this is the need for our people. Can we create a avenue for us to all have what we are supposed to have?
Right. Okay, and Kay, tell us about yourself and what brings you here.
Well, my background is completely different from Natasha's. I am born and raised on the south side of Chicago. I grew up in Auburn Gresham. I have experienced a background in nursing. I started out in long-term care, and then I progressed to nursing administration, and then I went to Stroger, where I worked in obstetrics and gynecology. So my background is heavily nursing. I also have a background in construction. So I started doing community work through an organization called CCE, Citizens for Civic Education. I did a lot of their, blogging or their posting. I ran the Facebook page on the political side of things. And that's where Natasha and I met. And then we linked up and we started doing things within the community, issues that came up like the strike, the past current strike. We did some political work. I held an event for another group called ECCSC, ex-felon community group. I threw the Mural Forum back in February, last year, 2019, right? And so right now I am interested in getting our communities back. Well, I don't want to say back in shape because I think we've been suffering for so long, but I want our communities to start to thrive like other communities, right? I live in a very gun torn neighborhood. Unfortunately, I'm in the 21st ward. There are a lot of shootings. I've seen a lot of young boys that I knew since birth through kindergarten. I have a 26-year-old son. I left that piece out. But so many of his friends have died, or people I grew up with, and I'm just tired. I just feel like if you grieve something, you have to get involved to make a change with those things that you grieve. So that's, why I'm here.
I mean, hey, Kim is really good at researching. She's
Oh, yeah.
a fact checker. She's our balance, because that's the thing, is like we want to lead with information that is valid,
Exactly.
that is relevant, so that people can make an accurate decision and understanding of where we are. And that's one of the basis of what we're doing too.
Yeah.
Okay. All right. And before we get into the weeds of what you're doing, can you tell us about the Black Community Collaborative and, who are some of their members? And Natasha, that's a question for you.
Yeah. So we founded Black Community Collaborative, myself, Brian Mullins, Helen Tyler, Rosita Shatanda, Willie Preston. I can name a few other people. Kay. And to me,
I love a nice, dangerous group. I love them.
that's what an alderman said when she saw us at City Hall.
Ursula. We have 9. So we got together around the time of the teacher strike. Now, we were very controversial in our stance against the strike. We were coming from a cultural perspective, and that's what made us come together. It wasn't that we don't believe in the right for teachers to organize and strike. We do believe they should have that right, and we actually believe in unions too. Because
that's right. You come from a union background.
Yeah.
Our purpose for standing against it was that we wanted to be sure that, we actually know that in the past, strikes have desecrated our community.
Exactly.
Has caused a reverse effect on teachers. A lot of teachers have been fired. Our students, Black students, typically their schools aren't getting exactly what the North Side schools or the, white or upper wealthy schools get. And so our goal was to shine a light on the education facts that's currently happening within our community, and to have the union and CPS really look at how can we make sure that if there's going to be a strike, that Black children and Black teachers are going to
it's beneficial
from it. And so that was what we did. So we all came together and we actually pushed CPU and CPS to really end the strike. We went up to Malcolm X. We held a press conference in front of Malcolm X while they were going back and forth, holding our children out of school, to demand that they, get it together, come to an agreement. And they did, actually. We spoke directly to the mayor's education assistant. We spoke to Stacey Gates and Jessica Sharkey directly, and we told them our concerns with the Black community and how we wanted to be sure that our teachers and our children are going to have their fair share in this cut, because we realized, though, that the Hispanic community, the Latinx community, got a lot of benefits out of their contract. And we know that they weren't in for us at all, And so that was our purpose and our goal. And we want to continue working on that realm to make sure that we are holding everyone accountable. Anybody that's a public service to our community or a political figure, we want to work with you. We want to also hold you accountable for the needs of our community. And that also goes to with this COVID-19 situation. And that's why we put together this group, because we know that usually
Okay.
Black people get the short end of the stick.
All right. And Kay, can you tell us a little bit more about the group itself, the
Well,
support group?
the point of the group, as Natasha has already stated, the point was to make sure that we are providing factual information to our communities. Unfortunately, there's a good and a bad side to social media.
Right.
It's great for communicating abroad, city to city, state to state. But we are fully aware that there are a lot of misinformation that is
Yeah.
spread across that platform. You have people who they use Facebook as their sole voice, and whatever's in their mind, they post it, and it gets spread depending on their followership. When this first happened, Natasha and I, we would talk we talk every day, multiple times a day. And when it first kicked off, we noticed that there was there was some confusion, right? Amongst our people, they weren't really understanding, what is this, what's happening, what's true, what's not, because, you had people that was adding to the equation. You had people who was, I've never seen so many people post about the medical field who have never read or went to school, for medicine. It's crazy, right? And then here comes all of the propaganda. So the point of the group was to bring factual information, true information. Our focus, though, is mainly on the coronavirus, as far as the resources, the causes, the effects, those infomercials on how to properly wash your hands, how to wear a mask, those pertinent details. My stance on it was to kind of keep the politics out of it. We know that the election is coming, and it can get kind of ugly, because
Not in Chicago.
in Chicago, because everyone do not honor the whole golden rule of political democracy. We all have a right to choose and vote for whomever we choose. And unfortunately, that does not go over well with some. So I felt politics, it was very important not to bring politics in it, because I didn't want us to lose sight on, what is the true issue. The pandemic is our number one issue. And that's what we need to focus on, because as, Natasha has brought up, and as other people have brought up in the posting of the group, unfortunately, it has now looked upon that the African American communities are the most effective. And we know why, because we have a lot of underlying comorbidities like diabetes, hypertension, heart disease. So we need people to be informed. And one more thing, and then I'll pass it back to you. One of the greatest thing I think about the group, the last time I checked, there was like hundreds of members. But the good thing about the group, it is like a rainbow, right? Mm-hmm. There's not all African Americans in that group. That's fine. Also, we have people from different walks of life. We have members of the Chicago Police Department there, members of the Chicago Fire Department there. We have nurses, we have doctors, we have respiratory therapists, we have community activists, we have people who are essential workers. Right, that's out here. So there's there's a spectrum of so many different people from different walks of life. And that's what makes it great, because in that group, we are united, and we're all grieving, and we're all hurting, and, trying to understand where we are today. And it's something that I pray that we can keep, and, for other things that come up, yeah, and we maintain that unity. But yeah, it's an awesome group.
Yeah, you know what? I was really, I knew it was going to be good anyway, because I knew Natasha, right? Everybody who knows Natasha knows that she's no nonsense. They know she knows the street lingo, but she can also advocate, go toe to toe with the best of them in terms of policy. So I knew this was going to be a good group, right? But when I got there, I was so pleasantly surprised, just like you said, it's a broad spectrum of people. And then when I looked at some of the content, like there's one lady who was, she was doing a survey so she could do a community needs assessment.
Yeah.
And, that's something that I don't see, I guess, in other arenas where there's a community needs assessment that is focusing specifically on our issues. We tend to get lost in the diversity, and God knows I support diversity, but sometimes we get lost in it because our specific issues are not included in those surveys.
But
So,
that was the number one driving force when we created this group. We had our first community meeting back in November, right before the holidays.
mhm,
And we had people from different wards. It was not just the 21st. There were people from across the city that came out, and we talked and we shared a lot of information concerning the issues that grieves our communities, right? And
mhm.
so that was one of the things that, Natasha and I, Brian and others in the group, when we talked, what are we going after? And we always felt like we need to be different from other organizations. We don't want to talk to the organizations, but we want them to talk back to us. So when when they're involved and they're interacting, they feel like they're solely a part of that. And that's what we want the community base, the people in the community, to feel involved. We don't want to talk at them. We want them to talk with us. We're it's a give and take. And that was one of the things that when we created a group, that's something that we tried to center, the creation of the group around, the involvement of the community.
Okay, awesome. And Natasha, how are some of the parents using this group?
From
It looks like your
Did it
screen.
freeze up?
Yeah, it looks that way. Okay, well,
There she
Natasha.
go. There she is, I think.
Okay, you see her? Okay.
yeah, I'm here. Hi.
I don't think
Okay.
she heard the question.
Okay.
I didn't hear the question. Go ahead.
Okay. Yeah. So my question to you is, how are some of the parents using this group?
So they're using it to get information, like up-to-date information about how to protect their families. We also have had just education facts and things based on CPS. We have a few education advocates who are also a part of the group who post information, up-to-date information on homeschooling. CPS just rolled out this week the online remote program, so that information is posted in there. And then it's just a way for families to be able to, and people in general, to connect with other people in the community and to be able to have up-to-date information and tips on what they need to be doing at home.
Yeah, and it's very reliable information. I can tell you, personally, I have gotten information from this group that I would not get anywhere else, even from
That's great.
elected officials. I mean, I found out about this town hall meeting that I never would have found out.
Yeah, and then we also want to make sure
into this group.
that we're keeping in tune with that, so that we can post.
Okay, Natasha, you're fading in and out.
Did she?
Okay, Natasha, can you hear us? Oh, okay. So Kay, do you want to pick up until she comes back in? I think there's a connectivity issue.
Okay. I mean, what was we? Because she was talking. I'm kind of.
Okay. Yeah. So the question is, I guess one of the things that I noticed is there was a town hall meeting, a virtual town hall meeting with the Black elected officials at the federal level, state level,
right?
County. And the way I found out about it was through this group. Okay, she's back now. So are you back with us? Okay, Natasha. Okay, yeah, she had to reconnect.
Okay. So what we have done, we make sure we have our own personal connections. People that we know outside of the group who do share information with us. So what we do, we make sure that information, if it's pertinent information, anything community based is important. We make sure we get it out there so that we can have the community involvement, at those particular meetings. Other than that, a lot of people would have never heard about, this town hall meeting was occurring, right? So that's just what we do. We have Brian Mullins, who, he's deeply into the politics, political
Right.
world. So he shares stuff all the time. We have other people in the group that shares with us about information, especially if it's automatic. Like City Hall just had a virtual meeting the other day. Quite a few of us attended that meeting. So anything that we get, any type of event, we're getting these, it's a pool. We're getting it from, our connections outside of the group as well as inside of the group. And actually, there's a lot of people in the group that are sharing this information. So they'll send it out and say, hey, there's a meeting I heard about, or my organization, because there are people in there with their own organizations. She's back. Yes. So
with this Comcast, I'm having issues with it. It keeps knocking me offline, probably because of snow and all of the people on it. Like, go ahead.
So I was pretty much Natasha. I was just sharing with her. She wanted to know, how do we go about the information that we get? And I was just telling her, it's from our connections, the people that we know from other organizations. That's what Black Community Collaborative is. It's about having that connection with other organizations to create a collaboration, right? So we can get information and share. So we share their information, they share our information. So it's pretty much a network. So that's how we get a lot of the events, and we post it in a group. Like, if it's pertinent to COVID-19, or if it's something about resources. We have 2 pages actually. So we have a page, that's Black Community Collaborative, the actual organizational page. And then we have this pandemic page. So we're putting information, as it comes up, as it applies, to certain events, we put it out there. So we're pulling it, it's like a pool. We're pulling it from other organizations or just people we know in general. So that's how we get the information.
All right. So Natasha, you are, I think you're a born organizer. You can't help it, right? It's in your blood.
It's in my blood.
It's in your blood. So what are some of the things you guys are doing? And I think Kate touched on some, what are you doing to take some of this information offline, so to speak, and actually implement things in the real world?
So one of the things that we're doing is we're actually collaborating with a group called Black Women Organizing for Power. And we've been meeting with them to create the needs assessment that you saw that's posted on the page, to be able to, get real-time information from people, just to get their input and what's happening in their homes. So we collect that data and be able to promote that and give that to our elected officials to create a need. Like, these are our needs and this is what we want from the community. I mean, from you as our representatives. The other thing is we're also working to advocate for more. Well, they started opening up more testing sites. So that's some of the things that we're advocating for, a little bit more. I mean, they're doing it slowly, but that's one thing. Also, creating a criteria where African Americans are seen quicker, admitted into hospitals quicker if they need to, because what's been happening before is that they've been turned around to go home to self-isolate. And so we want to ensure that people who have these comorbidities, as Kay mentioned, that they're being seen immediately and that data is being collected as well. And then also making sure that after the fact that there's information, there's streams of income, possibly even, disability income, things like that for our community to be able to have after this is over with. Because, I mean, we know that this disease can actually cause long-term effects on your lungs. And so we want to be sure that our community is not going to suffer economically as well. I mean, there's a few other things that we have on our list that we're working on, trying to work with our legislators to support it, but then also to get the people involved in it from the needs aspect.
Okay. All right. So you actually have an agenda that's in the works. That's awesome.
There's someone here that said that they can't hear us. Did you see that? There's someone that commented and said that they can't hear us.
No, I need to scroll down. Okay. I'm going to type in a response to Crystal.
Yeah.
And this is Crystal Overton in Congressman Davis's office. So while I'm typing, I'm going to leave a question out there for one of you to pick up. How are housing advocates using this space?
Well, that's a good question. You can answer that.
Well, we do make sure that, well, we have been giving out the resource information concerning like the rent, the $1,000 rent grant or lottery that the mayor advocated and has spoke up about.
Mm-hmm.
So with the housing, there are we're putting the information out, but
Mm-hmm.
we're still pretty much dealing with I guess the logistics of things. We have
Mm-hmm.
to, because right now it's hard to meet. It's hard to get people to meet because no one wants to come in contact with each other. So we pretty much have to find another means like social media, like how we're doing meeting with you, where we can actually meet with those groups to see what are their needs, where are their needs being met, and what is it that we can do to assist with that. Right now, the only thing that we are able to do is we put the information out. So
Right.
like I make sure that the information is posted at least once a day as it
Mm-hmm.
comes up, as it changes, we put it out there. It's from everything from housing, when it
Mm-hmm.
comes to rent assistance. There's some information I have, but I'm working on because I want to fine tune it and make sure it's actually accurate. It's
Mm-hmm.
concerning the homeless community, and I'm trying to really see where the mayor, how she's going to pivot that and work that in. So there's more information that's going to be coming up on all fronts concerning all issues. But right now we're still working on those logistics of, hooking up with all those organizations
You know
for
what
the most part.
what I'm hearing is this needs to be a two-way street.
Yes.
The information you're putting out there is extremely valuable. I
Mm-hmm.
always share it, in my network, and I, let folks know where I got it from.
Mm-hmm.
I think we as users need to let you know how we're using it so that you can then continue to advocate for more resources and help us, if that makes sense.
Yes.
Yeah.
Mm-hmm.
Yeah.
Yeah.
That's something that we'll work on. Thank you.
Yeah.
All righty. And I'll be better about accounting. I can tell you how I use the information. For
Okay.
example, when I learned about that town hall meeting, I immediately put that in my newsletter, which went out to over 1,000 people. I posted it on social media, and there were some people, within the nonprofit Utopia Network who attended, and we would not have known about that but for the grace of God and you guys. And we were able to ask, some pretty interesting questions. Now, I'm hoping that the elected officials had someone to actually jot down answers. I mean, they had over 104 questions that were asked,
Yeah.
and we need to hear a response. But we did get a question in our forum for you guys. Amandelo Kuzan, cousin, he says, thank you for organizing this forum. Credible information is really important right now. Can you please take a moment to share the best ways to wade through the more outlandish myths and misinformation about the pandemic? There are people already saying they will not be vaccinated, even though one does not even exist yet, because Bill Gates is going to plant a microchip. And that's just one of several ideas that are being pushed out with intensity. So if you have any strategies that we can use to, sift through, what's credible and
So
what's not.
So what I do in researching these topics, it's not a one stroke hitter, on the keyboard.
Right.
It can take hours, and you have to be dedicated to it, and you have to be very patient. And it's a lot of reading, right? Depending on the subject. So with the Bill Gates, the vaccination, the microchip, what he's talking about. Unfortunately, I have ran across a lot of propaganda, a lot of informed information concerning it. I've yet to really find out what his true what his true intention or plan is. He has not yet really released it. He throw tidbits out, but he's not really giving us full information. So it's kind of hard to deliver something when we don't have the full, info.
Right.
Because if I put it out now and then he changes or fine tunes it opposite of what I put out, that's going to cause some confusion. And then we have to go back. And sometimes when you feed people this information the first time, if they believe it, they hold on to it. And it can be wrong. They'll hold on to it. And it's kind of hard to, try to guide them in a different, direction from, what the path that they're already taking. So with the vaccination, there's a lot of stuff that I'm researching on this. The vaccination is one. I want to make sure we're getting thorough information before I put it out there. For me, it's kind of hard to talk about a vaccination when they're saying that they don't have one yet. They don't even, they're still trying to get it together. They don't even know yet. They're still playing with it. So it's kind of hard to put that information out, right? Because, as a nurse, I know that, medical information changes a lot. It really does. And so when you put it out there, if I put it out there now, like they're saying a microchip, it might not be a microchip. It might be a basic vial, like all the other vaccinations, right? A vial, an injectable vial, you take the medication, that's it. If I put out a microchip, right, and people are really believing us, when they come with this vial, then you're going to have this resistance, like, oh no, that's not what the Black Community Collaborative told us. We're not believing it. So we, right now, and we have to be kind of delicate with the information that we put out. But I just ask everyone to just bear with us. As soon as I get the meat of what his plan is, I am more than willing to share it. I will share it. But I just would like to encourage people to right now research vaccinations, know the history of these vaccinations, know what has happened, look up legalities, look up what lawsuits have come up, what was discussed, just research those things right now. So when it comes out, you already have a sense of understanding. It's more than just getting a shot. You'll have a sense of understanding if you do the research, right? So when it comes out, a lot of stuff won't be a surprise to you. It's like, oh, I read that. I'm okay, it should go across a little bit easier.
That's the key, is to be able, number one, like I said, we want to be sure that we're providing some valid information. So that does take research, that takes making sure that we're getting information from accurate sources. But then also that we're communicating it in a way where our community can understand it, and that we're sort of dispelling any myths around it. And that will include providing a history and a background. Why
exactly?
Why the reason why I believe, and I'm not a vaccination person. I don't believe in all vaccinations. In fact, my children, for school, I do the waiver for vaccinations because most of which I believe we're sort of immune to. So some of the vaccinations, I'm like, nah, we're not gonna do that. But I think for this particular case, I would get a vaccination just because this is a new virus. And I think if people understood that it's new, we don't know anything about it. We don't know what we're learning as we go along. And that this is causing, obviously, ravage in our community. People are dying. People are getting sick quicker. If you have hypertension, diabetes, which most Black people have, you have a higher risk of getting it and or dying from it. So as a result of that, I think it's important for us to really understand the need for vaccinations and also look at the success of vaccinations. Now, the truth is there's going to be some trial and error just because it's new. The vaccination will be new. So we will probably be walking placebos in it. But at the same time, we have to look at the bigger picture, knowing that don't we want to get back to our regular way of life, right? Do we want to be able to get back out and talk to people face to face and be able to, be in large groups and gatherings? And if that's the case, we will have to get vaccinated. It's a possibility we would have to do that. So I think we should start weighing out the good versus the bad, and know that for the most part, I don't think that the world is out to get everybody. Yes, there will be some issues, but we're going to research information to make sure that it's accurate and make sure that it's safe for our people. And work from that.
And also, like I said, and I would encourage everyone, if you have any type of comorbidity, if you have hypertension, asthma is one of the ailments that some vaccinations work against it. But if you have these illnesses, I would encourage everyone to start researching and see what vaccinations that are already created that might affect, the ailment that you already have. Like, get an understanding clearly of what's going on with you and your body. So when this stuff is presented to you, whatever questions you might fish around and have, then hopefully at that time, someone will be able to answer those questions on your behalf. But I think right now, everyone should be encouraged to, to start doing the research, especially for themselves, for your family, so you'll know what possibly you might be getting into when this vaccination comes along, so yeah.
Okay, ladies, we're going to open it up for questions, but before we do that, I just want to let you know that Crystal indicated that she still can't hear us. She's going to call me, and she'll probably have something to say. And I want to just check out these questions, but before we do, I want to ask Natasha, what are some of the lessons that you guys have learned along the way?
The things change every day, and to just be flexible with that, with information, and that this is going to be a long road. It's not something that's going to be an overnight catch, because we're actually seeing the disparities, the health disparities that's been going on for a long time that has not been addressed. And so we're looking for a long-term plan. That's the whole goal. Like, this is a group. Yes, it's a Facebook group, but the goal is for us to be able to just start the conversation about the needs in our community and to build forward so that we could, have a long-term impact on what we need to be doing in our community to make sure that we're healthy, make sure that we're connected, and that our issues are addressed. So just, having the flexibility, and just being able to provide accurate information as it changes.
Okay. All right. Did you have anything to add, Kay, before we go to these questions?
One of the things that I've picked up the most on, I knew fear could be a powerful thing, but I had no idea that it had this much power. Fear is really driving a lot of the confusion, that we're having, especially on Facebook, trying to understand and trying to share, what we think this is. And not us per se. When I say we, I mean as, just as a nation, everyone that's in this country, the things that we're sharing because we're afraid, we're trying to come up with stuff and it's not always right. It's just, fear is, we have to really be careful with fear. We have to get out of those, oh, it doesn't affect Black people. Oh, it doesn't affect the young people. Oh, it only affects people with illnesses. Real quick, I lost a cousin last week to the coronavirus. Her funeral service is actually going on as we speak. She had no underlying ailments. She was healthy, and the virus took her, so it's kind of, you can't, it has no respect of person. And that's something that's the lesson that I'm getting out of it. It has no respect of person. It doesn't care about your age. It doesn't care about your race. It doesn't care if you have ailments or not. It is taking people, and it is not playing. It is, it's crazy, so that's something that I'm learning, that the coronavirus has no respect of person. It's taking bodies. So that's just where, that's where we are with this.
And then I also want to add to real quick what she's saying is that I think that the other key to take away is that this is a stressful time, and we should acknowledge it, but also try to figure out ways where we can reduce the stress in our home, because the stress is also going to be something that could contribute to us getting sick in another way, right? So figuring out ways that we could create spaces in our homes, maybe within our communities with social distancing, where we could relax and be able to have some sort of peace and some sort of focus on what's positive and what's to come. Because if we keep constantly hearing all the death, that definitely can cause us to have emotional issues.
Yeah.
issues as well.
Yeah.
Okay. All righty. We got 2 questions in our forum. Okay. So the first question, and both of these questions are from Leighton Olson. And Leighton is an attorney as well as a consultant. And his big focus is on technology and bringing networks of community groups and institutions together. In fact, he's going to be on our show next Friday. And his first question is, please address the role of libraries, including the distribution of files. So what do libraries do to help us?
Okay. So it kind of broke up. So I want to make sure I'm understanding. He wants to know how can we address the roles of the library and how could they be beneficial to us during this time, right?
Yeah.
Well, I think the library, as it always have been, it is a research palace. One of the things I did, Natasha's a witness to. I have taken a point of researching past pandemics. So I watched documentaries about influenza, like all the way back to the 20s, to the 30s, those past pandemics. I look at how they handled it. They was doing sheltered in even back then, right?
Mm-hmm.
And I think with the library, you have books, you have publications that can give you that information on the past pandemics. How did it come about? How many people were affected? How many lives were taken? What were the solutions? And then, for me, I like to align the past with where we are today. So for that, you can get past history of pandemics from the library, right? You can use the library as far as the computer systems, searching, Google search, Bing, Safari. But for the most part, I would say use the library to understand the past instances of pandemics, and then try to pull yourself to where we are today by going through those past instances. And I think you'll kind of understand pretty much why we're not being told everything at one time, right? Why people are having a hard time believing something as little as shelter in can really be effective. This stuff has all happened in the past, so I will use a library. To me, in my opinion, I would use a library for those instances to research the past pandemics, so that you can understand the present pandemic, where we are and why they're asking us to do stuff like sheltering in and etc.
And I also add to that I see them as a technology hub as well, providing that resources technically, but then also supporting our education system virtually as well. I think that they should be playing a very vital role in working collaboratively with CPS and making sure that our kids have the information they need virtually as well.
Especially since the kids are doing e-learning and they're at home. I think the libraries, they may be some type of technology hub where the kids can with my son, and I don't know how Natasha feel, my son is now 26. So when he was going to school, technology was real big, the iPads, the G-pads. And so my son thought that he can only read a book that was on an electronic device. And I'm like, no, baby, pick up the actual book, because there is a difference. There's some information left out of the actual book. People take shortcuts sometimes with, like, what is the book? The Book Thief. He had to read that, and he got it off. He was off the device, but then I made him read the actual book, and he like, Ma, it's like 3 chapters that they didn't talk about. And I'm like, see, you have to, I think that would be beneficial for the kids to give them those resources, and, not making learning, I hate to say lazy or easy, but fish for that education, fish for that knowledge. And sometimes you have to open up the book, an actual book, to do that. So, I think a library should, be a great tool for our kids to use, as well as the parents. Yes, the parents too.
Yeah, and I guess along those lines, I'm thinking maybe the library can actually facilitate, I guess, right now a virtual town hall. Since they have the
yeah.
technology, they can host those meetings, right?
Mm-hmm.
And then when we get past COVID-19, hopefully they can continue to be like a town center or something to host, other meetings. Because they do have community rooms and all that good
They
stuff.
do. They do.
That's an idea.
Yeah, let me see. Leighton had a second question. Would Congressman Davis sponsor the community dashboards for safety and mobility act in the next federal bill? Now, I don't know if Crystal is still on. Crystal has left us, so that's a question for Crystal. She wasn't able to hear, but I think that's a very good question. And Leighton, thank you so much. Thank you for that. All right, so it's 10:55. We got about 5 more minutes left, ladies. And my question to both of you is, what's next?
So what's next is we're going to continue collecting information. We are going to start promoting this needs assessment so that we can make sure we're getting as much accurate information as possible from our people. And we're going to facilitate, we're going to do some town hall discussions as well and invite elected officials to them to hear from the people. And yeah, we're in the process of pushing the city of Chicago to create an African American advisory council because we believe that this is the tipping point. I actually wrote the city a while ago using data that suggests that we should have our own specific advisory council to work on issues in our community, but to be led by people in the community. Because one thing I know for sure is that we have a lot of experts in our community that's been doing this for a long time, and we know, and we live here. We're Black, and we live here, and we know what we need to do. And I just think it's time to have a space we all come together and work in collaboration with the city. So pushing further with that. I did have a meeting with Candace. She's the chief equity officer, and while at the time she's open to it, they already had their set advisory councils that they wanted to promote. And I think a fifth one or a sixth one would have been too much for them. But I don't agree with that. I think that it's not too much. It's what we need, especially considering now where we're at with this COVID-19. I think this is the icing on the cake. So we're going to continue pushing for that advisory council.
Before you say that, that's so interesting. Natasha knows that I don't agree with Brahm Emanuel on most everything. Probably 98% of the stuff we disagree on. But one thing I do agree, never let a crisis go to waste, right? So use this opportunity, right, to promote something.
Use your numbers. We're gonna use your zip codes to your numbers, and we know where they all are in our community. So come on now.
Right. So two of the things that I was already currently working on before this pandemic, which is now even a greater need as far as employment resources. Not going to give too much. We are working, the Black Community Collaborative, we are working on a resource, an employment resource that would help provide employment, especially now. People are losing their jobs due to this pandemic. Some businesses very well might go out of business, so we're going to have more unemployment is up. Sky's the limit now. So right now, one of the things that I'm working on is employment resources. Having that information out so that people can go out and obtain those jobs. Also, I have a connection with a couple of community centers who do interview courses, entrepreneurship courses. One of the things that I want Black Community Collaborative to do is to help close the opportunity of divide, because that's something that's really needed. If you go to the job, be able to land that job, and get that job. Also, another thing that I was currently working with in conjunction with Patrick Brutus and I think her name is Kate, I was already involved with the Invest Southwest initiative. that was already underway here in Auburn, Gresham, South Shore. So we're still gonna, keep our eye on that. Yeah, keep our eye on that and make sure that that money that was set aside is being used for things that we truly need to build up our community. Besides the flower pots, some
Right.
real, right, some real, things that are going to really help benefit our community. So I am still involved with that as well. So that is a couple, and then I have another project with the felon community. There are some things that I want to do as far as aiding the felon community as well as the homeless community. So there's a lot of things that we're working on in the future. Yeah.
That's awesome. You know what? I need to share with you, since you mentioned Patrick Brutus and Invest West, as you guys remember, they did on the table discussions last year. They normally do this every year, but they decided not to because of the pandemic.
Right.
I was in a group with Patrick Brutus and some other African Americans on the South Side, looking at, I believe, 6 communities, and I'm just speaking off the top of my head, 6 communities, including Auburn, Gresham, South Shore, Grand Crossing, and
New
some
City,
other.
New City is one as well. Well, back of the yards, New City. Is it? I think a part of. I want to say there was like a segment of Ashburn, but don't quote me on it. Because there was a total of 10, and there's a total of 10 communities that the funding is going towards. But I believe the meeting that you talking, there was about 6, but yeah, it was South Shore, Auburn, Gresham. I even think Inglewood was there too, if I'm not mistaken. Yeah, Inglewood was one too. Yeah.
What I'll do, I'll share with you our memo to the mayor. Since it sounds like some of those people in your group who are working on this, and Patrick was one of them. He wouldn't mind. So they had a pretty comprehensive set of alternatives and recommendations that they shared with the mayor. We never heard back, but this information I think is so rich. It's sitting there on my hard drive. Somebody, somebody needs to use it, right?
Right.
I will share this, in the forum, and you guys have at it,
Okay, thank you so much.
All righty. So it's 11:02.
Yes, and I have another conference to do after this. But I thank you for having us. And
thank you.
we'll keep communicating and keep sharing information to empower our people.
Yes.
All righty. And thank you guys for inviting me. I mean, I've learned so much. All I have to do is, go to the group and I can answer almost any question that was on my mind just from looking at the stream in the group.
That's good. Thank you. That's great. Good to know.
All right. And before we go, how can people contact you? And well, before that, how can people try this at home? There may be other people who may not necessarily be focusing on the same issue, but the process might be similar. You know what I mean? There may be other community groups who might want to, if they don't want to organize around COVID-19, they may want to use social media to organize around something else. So as you give your parting thoughts, just give some thought to how people can try this at home and how they can contact you. All right. So I'll leave that for both of you and then we'll go.
Okay, I'll start. The first thing is that we can be contacted via Facebook. We have a Facebook page, the Black Community Collaborative. And then we also have a Gmail account, Black Community Collaborative at gmail.com. I think the way people you can always reach out to us. We're there and willing to assist and work with people in groups to help collaborate with them on a way that is best suited for them. And I think that's the thing, is identifying what your needs are first, and then we can sort of help navigate around what that is. And so providing some assistance and consulting.
Yeah. So, and my contact is the same. You can reach either one of us through what she had already stated, our website. I mean, the Facebook page, the Gmail account. Yeah, that's it. Or through the pandemic group. You can always message us through there as well, through the Black Community Collaborative pandemic group. You can get us through there as well.
Okay.
Yeah.
And then ideally, now, do you have to have any background? Do they have to be invited to join the group, or can they ask to join?
They can ask, but how it happened originally when we did it, we just blasted a lot of invites based off our pages, and then we left it open for those people because I wrote an initial post saying, invite, invite, invite.
Oh,
So people can invite out the group, or they can search out the group and they can just ask to be, invited in. It works
okay.
either way. Yeah, it works either way. Mm-hmm.
That's good. All right. Thank you so much, and we'll be in touch.
All right.
Thank you.
All right.
All righty.
All right.
Bye.
All right. Bye-bye.